Good morning. Good morning. We're here this morning with special guests, but I want to welcome you to Imani Faith Health Initiative and the Mending Threads Transformation Series. We're going to talk today because we know that it is uh, entitled, and we're going to give a different frame to it, entitled Breast Cancer Month. So we want to lend some time to look at what this really is. And we have a special guest with us because we know that this is your safe place and your stronghold for whole body wellness. So we have with us our whole body wellness physician, Dr. Floyd Atkins from the Center for Wellness and Healing. Welcome this morning,
Good
Dr.
morning.
Atkins.
Good
Good
morning,
morning.
Doctor. How are you
Thank
doing
you for
today?
getting up early this morning to talk with us about cancer. And we want to look at cancer awareness because it's all around us. And I was reading something the other day, and it says that the health of any population is directly influenced by physical activity, political and economic climate, and the lifestyle choices and the availability and access to resources. Now,
Yeah,
those were the areas that they said, and say you could determine when you measure those the health of an individual or the community.
that
And
is
so
true.
that's right. And so I wanted to see what your take is on this whole thing. But I know this sounds like a real simple question, but I wanted to know, we've been talking about cancer. What really is cancer from your point of view? What is that?
Well, cancer is it's a defect in the way our DNA is made up. And I have a PowerPoint I want to share with you some slides about what I want to say about that. One thing I want the audience to know, first of all, is with cancer, it's not something that usually starts off in one day or 1 week. 1 month you don't have cancer, and 1 month you do. Cancer is a slow going process in most cases. There are some cancers that go rapidly, but rapidly is like about a year. But most cancers can take anywhere from 5 to 10 years to develop. So when people get diagnosed with cancer, it just didn't start last year or last week. It's something that's been ongoing for a long time. And once you have enough defects in your cells in your body, it can form into a tumor. And then once it forms into a tumor, usually at that point they want to do a biopsy to identify it. Then it can be identified. But we know what I tell patients when I talk to them about uh, diet and nutrition is that at any one moment during our life, at every moment during our life, we have um, thousands of cancer cells in our body that are circulating. These are cells that have formed uh, irregular, abnormally, or they don't do what they're supposed to do. But your immune system can kill those bad cells anywhere from 30 seconds to 2 minutes. So if your immunity is where it should
Wow.
be, in 30 seconds to 2 minutes, those cells are destroyed. Now, when our immune system is not functioning properly, those cells tend to accumulate and multiply and accumulate and multiply until they grow into a tumor. And that's where we have a problem. So let me answer your question here about exactly
Okay.
what cancer is. I'm going to share this presentation with you real quickly here. Um, and can you see that screen now?
No.
Okay. Can you see it now?
Yes, I can.
Okay, so it's a short presentation, but it's called the nine most important common risk factors for cancer. And this is part of a longer presentation, but I'm gonna give you the short version of it. But I want to go over some of the statistics first that we see in the United States, and these are old statistics, and statistics have grown since then. This is a data that the United States government put out in 2006, and what is basically showing on this as an incidence of cancer uh, versus race and ethnicity. And so we see where whites, blacks, American Indian, Pacific Islanders, and Hispanics rate. But one thing we see is what's going on with COVID now, and what's always been going on in the case when it comes to um, cancer. Blacks tend to dominate that category, especially black men as opposed to black women. So, and that has only grown since the time the statistic was done. But almost in every category of health, uh, Brown and Black people dominate those categories. Now, since this is Breast Cancer Awareness Month. And again, we try to reframe it. We call it Breast Health Awareness Month because we don't just focus on one thing, breast cancer. We want to focus on breast health. This is the time we focus on those things. So I want to give some statistics just concerning women mostly here. And this is the 10 most commonly diagnosed cancers for women. And these are done a little over 10 years ago. Cancer of the breast, lungs, colon, rectum, uterus, and thyroid. These are what we see in women. Non-Hodgkin's lymphoma, melanomas of the skin, those are skin cancers, and cancers of the ovaries, kidneys, and pancreas. And that's what we see with women. It's estimated that about 1.5 men and women will be diagnosed with cancer. And this was all from 2010, and that number has increased again. I can give you updated statistics, but I don't like to focus on the statistics because I want to focus on what do we do about it. But let's talk
Trend.
about what is cancer.
Yes.
Now, this picture here is just a screenshot that shows you what a DNA strand looks like. And at the top here, it shows a circle right here. These chains connect each one of these strands. Well, sometimes the connection with these strands are broken. They're disrupted because the cancer cell doesn't forms abnormally, and those chains can't be connected, or that cell may be abnormal. And to the left up here is a really electron microscope picture of what a cancer cell looks like. And this cell is not normal, and it doesn't do the normal function that we expect our cells to do. Uh, Cancer is a term used to describe a large group of diseases that are characterized by cellular malfunctions. That means the cells are not doing what they're supposed to do. Healthy cells are programmed to know what to do and when to do it. But cancer cells do not have this program. Therefore, they grow and replicate out of control. They have no physiological function. That means cancer cells don't do anything that your body needs to do. It's doing its own thing by itself.
Mm-hmm.
It's not following the normal program. Like if you have a cell that's supposed to cell in your stomach that's supposed to have produce acid to digest food, it doesn't do that. If you have a cell in your lung that's supposed to help have oxygen exchange, lung cancer cells don't do that. They tend to grow and grow, and they destroy all the cells that are exchanging oxygen, and therefore you can't get the oxygen you need.
So what? So can I ask you a question?
Sure.
So when you were saying something when the acid, when the cells in the stomach are supposed to produce acid and they don't, is this associated when people say I feel acid in my chest or acid reflux? Is it something about an indication that the cells aren't doing what it is? It's off balance.
Well, that's an early sign. Like when people say I have acid reflux, their cells in their stomach are overproducing acid. They're producing too much acid, and that's the first sign that some abnormal things are going on. When you chronically do that for a period of years, then you can form a stomach cancer because those cancer cells just grow out of control, and they'll get when they stop producing acid altogether, and those tumors will keep growing, and you won't produce any acid. You won't be able to digest food. Most people who have stomach cancer, one of the biggest signs they lose their appetite. They can't eat. When they eat, it's very painful. So we always start evaluating people for stomach cancers at that point.
Mm-hmm.
So yeah, that's the first sign of abnormalities. Another thing, more disconcerting, is the ability of cancer stem cells to hide. And this is a big factor that most people don't realize, that not only do you have cancer, and I'm going to show you, this is this blue part. Excuse me. And in really, this picture here shows what a cancer cells look like. But these little blue things here are called cancer stem cells. The blue thing, the yellow is considered cancer. But it says with chemotherapy, it might effectively kill the entire tumor, but stem cells might evade the drugs and relapse in cancer for years. So although they can kill cancer cells with chemotherapy, radiation, surgery, some of those things don't always affect the stem cells that are around here. Stem cells they don't act like cancer cells. They don't look like cancer cells. So once you kill the cancer cell, and they might declare a person, oh, you're cancer free, you're okay. But what happens, those stem cells over time will change into cancer themselves. And then a year later, it said, my cancer came back. Or all of a sudden, I thought they had it all, or things like that. So you have to focus on not only killing the cancer cell, but also the stem cell is a cell that makes cancer. It's another bad cell that's invisible to most chemotherapy and radiation. That's what in cancer treatment and cancer research now they're trying to find ways of killing stem cells. What
Oh, wow.
people
Mm-hmm.
So let's talk about some of the risk factors when it comes to cancer cells. And number one, and it's multifactorial, which means there are a number of things, not just one factor that cause cancer. There are a number of things, and most of them are environmental, and I'm going to cover them here. Exposure to cancer-causing agents. And those are things like chemicals, pesticides, and we know when we talk about food, we talk about pesticides, herbicides, fungicides, all the chemicals they use to try to protect the food, but they're harmful to our own health.
Mm-hmm.
Cellular mutations. When your cell mutates or changes, um, that's another cause. Those are environmental or lifestyle agents. I can talk a little bit about that, but I'm not going to go into detail on all these right now. I just wanted to give
Yeah.
you the risk factor. Genetics or hormone exposure. Sometimes people are exposed to hormones and chemicals, to hormones and other drugs. Genetic changes. That's where we see our breast cancers and prostate cancer. Environmental and occupational factors. That's when we see the asbestos or people working in plants or chemical companies that develop cancers because of exposure to chemicals. Those chemicals actually damage your DNA, and you form a cancer based on that damaged DNA. Social and psychological factors. This is one that people don't really consider, but stress and emotions are a big factor when it comes to development of cancer. There was research done many years ago that shows that when people go through traumatic life events, such as a death of a loved one, such as a divorce, such as a financial loss or devastation, a
Sure.
bankruptcy, within
Mm-hmm.
6 months to a year, they develop certain types of cancers depending on where their immunity is lacking. Chemicals in the food. I've talked about that many times, but I hope people understand that's self-explanatory. The preservatives in food, the way food is processed, those are chemicals we don't see. There are viral reasons for cancer: herpes virus, HPV, mononucleosis. Those things can all viruses actually damage DNA, and by that DNA damage, you put yourself at risk factor for cancer. And also medical factors when it comes to just having medical therapies. Like when you have cancer and they give you chemotherapy to kill the type of cancer you have, many of the chemotherapies they give you also cause cancer. So if you look at the insert or the definition of those chemotherapies, not only do they kill cancer, but they cause a different type of cancer. They can
Answer.
cause lung cancer,
Mm-hmm.
cancer,
Mm-hmm.
essentially radiation. So again, estrogen exposure is a big factor. So understanding that a woman has an increased risk for gynecological cancers if she's exposed to too much estrogen, and that's the breast or the uterine. That's why they really stopped the overuse of birth control pills. They've been trying to find other alternatives because they find that those synthetic estrogens are more
Mm-hmm.
cause of cancers, and a lot of the hormone therapies that they were giving. And I want to emphasize those are synthetic hormones. Those are the natural plant-derived hormones that have shown to be safe. Uh, Now it says men, women, and children suffer estrogen dominance. That means too much estrogen exposure. And where do we get this estrogen exposure from? The word xenoestrogen here in blue, that word means xeno means false estrogen. These are molecules that in our environment that look like estrogen. They have the same shape of estrogen, but they're not a real estrogen, but they act that way. Xenoestrogens are pesticides, plastics, industrial waste, car exhaust are like xenoestrogen inhaling car exhaust, certain meat products that have chemicals in them, soaps and many carpeting, off gassing from carpeting, chemicals on furniture, things we expose ourselves to every day are the
But
xeno.
Dr. Atkins,
Yes.
well, it would seem to me that if these things are actually causing the false estrogen and these particular things,
Uh,
uh, it would seem that those things would be banned and not available in the market when they can see that it is creating harm.
it would seem that way too, and it would seem that that our government would find will address our pandemic that's going on, but people tend to ignore them because of finance, because of money. a lot of industry puts money or profit over health. They have banned pesticides like DDT and a lot of pesticide exposure because they know they cause cancer, but a lot of them are still on the market because they don't have any other options for addressing the issues with
Mhm.
saving the food. Car exhaust, that's why I've been moving from leaded gas to unleaded gas because we know that leaded gas and car exhaust and diesel fuels are loaded with cancer causing agents. But we don't completely get rid of it. We should be doing electric cars. That's why electric cars are so important. Plastics, microwaving in plastics break down and those chemicals can cause cancer, but plastics are so have become ingrained into our whole environment right now that system is not willing to let it go. So yeah, that's a challenge that we really need to address and stop just ignoring it. Obesity, this is another factor here that causes cancer. That when people are overweight, it says 1/3 of Americans are obese. Obesity is a risk factor for multiple conditions, including diabetes, hypertension, and cancer. So if you know that being obese is a risk factor, if you can address that, you lower your risk right there. It doesn't mean it's going to cause cancer, but it's a risk factor. You don't want to have multiple risk factors. Number three is the carcinogenic chemicals. Again, these are chemicals from I call that first picture here is what we get. We're living in an industrial city like Pittsburgh or Houston or even the West Coast where there's a lot of pollution. These uh, insect repellents and cosmetics and cleaning fluids, all these things are cancer causing agents. Benzene, formaldehyde, diesel exhaust, and are very dangerous in high concentrations. Um, Another risk factor is ionizing radiation. When people have too many, at one time when we in medicine, we used to always do an annual chest X-ray on people. We do chest X-rays every year, but they don't do that anymore because they find out that multiple chest X-rays over many years can lead to cancer. Having too much radiation, whether it's dental, you want to make sure you're
Mhm.
protecting yourself with the proper shields. Having too many MRI has over 100 to 1,000 times the amount of radiation as a chest X-ray. Even with mammograms, you get a small amount of radiation, although that's the gold standard when evaluating breast health today because that's what they consider it. But mammogram misses anywhere from 30 to 40% of tumors because they don't always show up on mammogram.
I,
But
I have a question about that. So when the person, what about the dye, injecting the dye into, for them to take a MRI? Does that affect in terms of cancer or affect the body in any way?
well, there's no research to prove that. We know that dyes have been proven to sometimes cause kidney failure and cause people to
Yeah.
have called what we call renal disease or renal dysfunction, where their kidneys are not functioning 100% anymore after that. I know we've had patients I've known of who had several dyes, and after about the second or third one, they developed renal failure where they had to go on dialysis. But those
Hmm.
same chemicals can be cancer-causing agents, but we don't have research to prove that. But I know
Hmm.
any chemicals that go in your body like that can damage your DNA and
Yes.
lead to cancer.
Yes.
Um, Other common risk factors, number five, is tobacco smoking. Not only tobacco smoking, but eating smoked meats, smoked foods. If we know that cigarette smoke will kill you, and you put smoke in that same smoke we put in our meat, and then we eat the meat, we're putting ourselves at risk
So
factors
you
for
speaking about barbecue, are you?
unfortunately, yes. When you smoke meat, when you go to the turkey leg hut, this meat
Yes.
is delicious, but you're putting a chemical into the meat that tastes good, but it causes cancer. We know that it leads to cancer. Well, when your house catches on fire and you're in the house when you're locked in and you can't get out, it's not the fire that kills people, is it? It's the smoke inhalation.
It really
People
is.
always die of
Yes.
smoke inhalation before they die of the fire. So if we infiltrate our meat with and our foods with smoke, we act like that's it's gonna be okay, but it's not.
Hmm.
Uh, Carcinogenic foods, and this is where people usually don't invite me back when I talk about this because there are a lot of meats, especially red meat. associated with several types of cancer, especially cancer of the colon, rectum, and the prostate gland. And that's because there are chemicals in the food called nitrosamines and acrylamides. We see them in sausage and bacon and things like that. And acrylamides are loaded in French fries, processed meat like hot dogs and luncheon meat and hams and things like that, loaded with nitrosamines. But those are chemicals that, and if you go to the Center for Disease Control and look on their list of carcinogenic agents, foods, I mean, things that cause cancers in humans, you'll see that nitrosamines are on that list and also acrylamides on that list. And we know that these things can cause cancer, but again, we haven't taken them out of our food sources yet. They're still there.
Mm-hmm.
Other carcinogenic foods are salted foods, pickled foods, smoked foods, the nitrites. So uh, eliminated food, um, eliminate foods such as things that have been char grilled. That char grill tastes so good when we eat it, but again, we're at risk. They're carcinogenic, which means they have the ability to cause cancer. It doesn't mean you're going to get it, but if you keep doing it every day, you really put yourself at risk. Nitrosamines have been shown are very common in cosmetics. It's an impurity that's found in most cosmetics. So you want to find an organic or natural cosmetic company that makes things that have been tested and don't have these chemicals in them. A couple more slides I want to show you here. These acrylamides. These are I call these are the most dangerous foods you can eat because they're loaded with acrylamides. One is potato chips. That's why many years ago they came out with baked potato chips because when you deep fry potato starch, it produces acrylamides, and that's a cancer-causing agent. When donuts is a flour, white flour that you deep fry a starch again, then you add sugar to it. That's a cancer-causing agent. French
Wow.
fries is a potato, which is a starch. When you deep fry potatoes that start at a high temperature, again, you have acrylamide.
Mm.
Tortillas is a starch from corn that you deep fry again at high temperatures, and it's going to cause is a risk factor for cancer. It causes acrylamides, and acrylamides again are on the list for carcinogenic agents. So we see that cancer just doesn't pop out anywhere. It's what we're doing to ourselves every day in many, many ways. Current research suggests the discovery of high acrylamide levels in food may explain previously inexplicable food-related cancers. And this is they come out and say, well, this is where we really feel this is where it's coming from, but they won't come out and say it definitely because it will
Mm.
affect the economy of the food industry. Alcohol is a big risk factor. During Breast Health Awareness Month, we want to emphasize that we're thinking that if you don't drink hard liquor and you just drink a glass of wine a day, it's okay. But one of the biggest risk factors for breast cancer, especially in women, and even greater in Black women, is having a glass of wine more than once a week, more than 2 ounces of wine more
Oh
than
wow. I just
once a
started. I just read something. I just started drinking red wine at night. I
week.
just I just started doing it. It says that it was something about the arteries or something that I read, and if you drink a glass of red wine.
Yeah, yeah. Red wine has a good antioxidant called resveratrol, and it's good for heart function. It cleans out your heart arteries and it's good for heart health. But the alcohol in the red wine is alcohol is a problem. That's what is a risk factor for cancer when you drink it more than they said. They I think the National Cancer Society says not more than 2 glasses per week. Dr. Pamela
Wow.
says 0 or 1 glass per week. She doesn't like to do that. So people who have it every night are just increasing their risk factor for cancer. So
Oh
yeah,
wow.
one instance it helps with heart disease, but when it comes to breast cancer, it's a tremendous risk factor.
Well, I guess that's out. Okay.
Well, making choices. Um,
I'll have to go to once a week.
Yeah,
Okay.
genetic predisposition. Understanding that people sometimes, based on family history, have a genetic predisposition. That's more important in colon cancer and breast cancer. We talk about having the HERS cancer, or people in families have a risk factor. But understanding that just because you have a genetic predisposition for a cancer, um, it takes an environmental factor. You have to do something to trigger your genes to go into that cancer mode, like environmental factors like alcohol, like chemicals, like food. It takes something to turn on those genes. They don't automatically. So if our parents or someone in our family has a gene risk factor, if we eat like they eat, live like they live, we turn on those genes, so we would develop it too. It's less likely if you don't have those genetic predisposition that you can develop that kind of cancer, but you can always develop other kinds of cancers. According to the National Cancer Institute, 90 to 95% of breast cancers are related to lifestyle. That's our diet and what we do, the synthetic estrogens and alcohol. This means that only 5%, 5 to 10% of all cancers are related to genetics. So if you see all these people out here, only a small circle, these are all only people who have genetic predisposition. The rest of these come because of what we do, how we live every day. And let me get the ninth one. This is the last one, psychological stress, which I know, Dr. Lewis, you can attest to because you can see how stress and psychological traumas affect the body. And what this
Yes,
says is evidence in animal and human studies suggests that chronic stress weakens a person's immune system. And that's a key factor. A weakened immune system just open the doorways for cancer, which in turn may affect the incidence of viral associated cancers such as Kaposi sarcomas and lymphomas. And what I want to
hmm
say right now is with the COVID-19, I think that's a risk factor why people can't, that people, many people don't decide because the viruses um, are able to, especially with people with a weakened immune system. And we see that in people of color because of their diet and lifestyle, their immune system is not up to par. So when that virus comes in, it can create a weak, it just attacks the body, and we can't recover from it as easily as some other people do, or some people don't even get it. It's a whole interconnection there that's not cancer related, but again, it's immunity related, and it's
yes.
psychological and emotional stress.
Well, I'm hoping that you're going to stay on a little bit when the nurse comes on because we're going to talk a little bit about that. So
Okay.
she's going to talk about that, and at the end, we're going to try to summarize some things to really do for all of it.
Okay,
Mhm.
last thing I want to say here is there is much evidence to suggest that repressed anger, hatred, and resentment, grief are the root emotional cause leading to the development of cancer. So when people are diagnosed with cancer, one of the cures is to address where their anger is coming from, where hate or rage is coming from, where their resentment is coming from, or where grief is coming from. Because if you don't, then you open your door for those cancers to redevelop at some time in the future. And so we want to really focus on that. And that's really, so if people understand that, they can, save themselves. The panda bear, they go through their life and they just relax, they stay in trees, they eat their bamboo shoots every day, and they don't worry about it, they don't stress. So they're telling us that we have to save the humans. The rest of this I can address later, but this is just talking about conventional treatments versus alternative treatments because there are a number of approaches. I hate to talk about one thing and not talk about the solution.
I
But
hope that in some time in the future, we could begin to link this to our daily practices for building immune system. Maybe the next time you come on and you present, we could really talk about more in depth of linking the cell and really begin talking about what we can do in our daily, visualizing and seeing ourselves doing this and knowing. Because I'm finding that in working with people through trauma and even myself working with my health and looking at this is the subconscious way that we practice things is built in, and
yeah,
then you have the environmental pressures, and if you are not working every day to make some tiny little change, so I find that there are interventions that we have to make in order to help people make those tiny little change before they can address this over here. They just can't stop. You just can't do it. It's difficult, rather. You don't know how
right,
until you actually connect the thread that will lead you there.
right,
And so I
exactly.
do. hmm
Yeah, and then I want to just reemphasize what you're saying. You're absolutely right. Again, people need to understand that it's multifactorial. There are multiple things. I can talk to people about nutrition and wellness, but if they don't address those emotional, psychological issues, their family
Right.
issues, or other traumas in their life, you're not going to get there. You
That's
always
right.
fall short. So
hmm
you have to give people the tools to do that. You give them the tools psychologically. I give them tools when it comes to their diet and lifestyle, and that's how you overcome it because that's the foundation of health.
So thank you so much. And I hope you stay on. And Nurse Sanders, Janice Sanders with the Fort Bend County Black Nurses Association.
Mhm.
And also she's a whole body wellness practitioner. So Um, Good morning, Nurse Sanders. How are you? Good
I'm good.
morning.
Good
Okay, and
morning.
so I don't know if you got a chance to hear what Dr. Atkins was speaking
I
about.
did. I
So
did.
today, I'd really like to talk about the COVID in terms of mental health and in terms of inflammation, in terms of what we need to do. So I know we've been talking about the COVID and talking about the COVID, but I became so alarmed because this morning I heard that the rates are again rising. And
Mm-hmm.
there's some concern that the children are now going back to school at the time that the rates are rising. And so, I see this picture, and this picture I have in my mind is that we have our youth who are put in harm. I see the parents having to work. And so I see the COVID I see our health practices in terms of what we talked about this morning, our eating behavior and whatever. And so what are some of your thoughts about the health in terms of engaging the COVID-19?
Okay. I'm glad you asked because today I want to talk a little about mental health, an emerging crisis in this during this pandemic.
Yes.
Um, Yesterday, I was looking at the news and I just wanted to cry because it seemed like all over Houston, whether it was the south side, north side, east side, somebody was killing somebody or harming
Yes.
somebody.
Yes. Yes.
From young and old. I mean, people, our own people shooting and killing each other. It it, it was very disturbing. And I had to tap myself on the hand because I encourage people to kind of stray away from listening to the news all the time
Mm-hmm.
because it becomes overwhelming. It really and it makes you anxious. Um, when you talk about the increase in numbers as far as with the COVID that our numbers are rising again. You know how it is when you tell a kid don't do that, don't do this, don't do that, don't do this. And the next thing you know, they're just acting out and doing what they want to do.
Well, I
I
think
believe.
probably is don't you think that it has something to do with what the person is thinking, the pressures that they're receiving,
Hmm.
from the environment in more ways than one, and more
Yeah,
from more than one direction. Mhm.
this whole pandemic has changed our norm, and it's going to be changed forever. A lot of people are beginning to, they said down the road we may be experiencing some post-traumatic stress, but a
Oh
lot of us
yes.
are acting out now. I mean, we feel it now because of the change in our routine, and we're having these anxieties. And some people say, well, what what does it feel like to have an anxiety? Because we moving so fast, we never slow down. We could be having a nervous breakdown when we were growing up, and your family tell you go sit down somewhere and shake it off. So we haven't even learned how to accept our own body changes, and listening to our own body. Some
Well,
people say,
you know what, Nurse Sanders, what I found that helps even now. This is a little simple tip. So
okay.
when you had games, children now sit. They
Yeah.
sit and look at TV. So
Mm-hmm.
one of the things is that when you invest, now this is going to sound weird, but when you turn the music on, or you just stand there and you just
Mm-hmm.
start dancing, you just start shaking and dancing. Now,
Mm-hmm.
so now this is an intervention. Anybody listening, you can try it, because I was sitting and thinking, when the stress comes in, right? What do we
Mm-hmm.
do? We get frustrated. So we got all of this stuff. You want to do something, you want to hit something when you feel boxed in and whatever. But it is
Mm-hmm.
something about just what you just said. You were right on it. When you start shaking and you
Yeah.
start doing something, what it does is
Mm-hmm.
it creates for the body a sense that it is doing something against something, and it
Mm-hmm.
immediately begins to decrease. Dr. Atkins was on at one time, and Mr. What's his name from New York doing biofeedback. And we found that when the people
Yeah.
would shake, 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 and we would start shaking and put those little leads on them and whatever, the
Mm-hmm.
stress, the stress 5 minutes would just go down.
Yeah.
Yeah.
You see, and
Mm-hmm.
so that's
Mm-hmm.
something that we're not doing anymore. We don't do.
No,
We won't
no.
do it anymore. We're just stopping. So I'm
Mm-hmm.
dancing with the refrigerator right now. So So, since the COVID, I have to social distance and I have to
Mm-hmm.
do a good intervention. So that's the best thing. They got a nice little handle on it and everything.
Mm-hmm.
So that's where I am. But I wanted to say that because you mentioned shake, 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 and I was just going for that. But
Just
you're right about that. They would tell you, give you a structure as to how to
yeah,
handle it.
because every go on, Dr. Atkins.
No, I
You
said
were
I
going.
think I'm gonna start practicing dancing every day too. When I
Yeah.
feel anxiety, I go get my bike. I say I'm falling in love with my bike. Where my bike? And I get on
Mm-hmm.
my bike and I ride, a couple blocks or whatever to do
Yeah.
something because it just takes your
Mm-hmm.
mind off of it.
Yeah.
I constantly don't turn the TV on because, like you said, the anxiety and stress is there. But that's all I want to say.
Mm-hmm. They say, well, what are feelings of anxiety, especially kids? And what are you scratching? You're itching. You got the skin rashes, headaches, body pain. You have feelings of sadness. Sometimes you don't even know why. You may be restless. You may be even experiencing some nightmares. Because you're having this rapid thinking even during your sleep. You have your TV on and you hear something. You People are increasing the use of alcohol, tobacco, and other drugs. They're self-medicating more to dull the feelings that their body is creating, the aches and pains or the headaches. We're doing more self medicating. Our energy levels are decreasing. Some people are increasing because they have this obsessive behaviors. We're eating more or eating less. We talked about quarantine 15 in our last meeting together, how
Mm.
we gained across the nation. Most people have gained 10 to 15 pounds. Um, some people are self mutilating. They're cutting. We see a lot of youth
Yes,
that
yes.
they're
Hmm.
not trying to cut a major vein or artery, but they're just cutting themselves. And you can explain more about that, Dr. Lewis, why they cut because it
They
hurts.
Well,
But
it hurts, but the pain on the inside is
uh-huh,
is stronger than the cut. And what they're, I mean, the pain is so strong. They're looking for something to release the tension, and they have no idea this is a stress. So what it is they want something that feels worse than what they feel inside, so that they could feel something. Okay, because
yeah,
the only other way
yeah,
they could do it is to numb themselves or to think themselves not being here. And so
right,
the cutting is a way of surviving. And
mm,
so one of the things that's their interpretation of the
right,
survivor. They have no idea that there's a secret inside of them for surviving. And until somebody helps them unleash the secret, then they're
mm,
externally trying to figure out that the
yeah,
secret is outside of them instead of
right.
inside of them. Hmm.
And so some of us have gastrointestinal disturbances. We may be nauseated. We may be secreting more of our digestive juices that cause our stomach to burn, and we may experience more acid reflux. Some are vomiting. Some have constipation. They can't even use it because their intestines are so tight and that they can't even use the restroom. I know when I was coming up and trying to be a straight A student that I wasn't. I was a good student because I studied, But I wanted to be a straight A student to please myself and my parents. And she took me to the doctor because I was a mess, torn up, couldn't use the restroom or nothing. So my doctor said, uh, do you curse? I said, oh no, Well, your stomach is so tight, your intestines, I can feel your intestines in a knot. I want you to say a bad word. Oh, no, 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 no. He said, I'm your doctor. I want you to say SHIT. But he wasn't spelling it. And, I just said, you know, he said, no, I want you to say. I said, no, my mom is out in the waiting room. I don't want her to hear me cursing. I just got baptized. He said, you need to say that word.
Say it
I
loud.
said, yeah,
That's right.
say it. Say a bad word. I said, ooh. He said, say that word. I said, okay, tit. He said, now say another one. I said, I don't know another. He said, you heard some bad words. I say, ASS. He said, say it loud. I said, ASS. He said, I want you to say a dirty one. I said, oh, God. And I just started sweating because I just knew I was going to die, go to hell. He said, say it. Say the F word. I said, oh, no, I can't say that. He said, well, say something really nasty. I said, winch. He said, that's
Right.
not no
Yeah, 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 yeah.
That's what my mama said. He said, that's not no bad word. I said, that's a bad word to me. But when I said that word, when I said winch, my whole body just relaxed. I could feel my shoulders go down, my muscles start relaxing. I was smiling and laughing. He said, so what's the deal? Why are you so tense? I said, well, I'm trying to do my grades. I'm not good in math. I can't do calculus or the algebra is getting to me, but I love reading. I like English, science, and I want to do good. I want to do good. He said, well, what do you want to be when you grow up? I said, well, I don't know if I want to be a nurse or a doctor. He said, well, to be a nurse, now you got to know calculus, when you go into medical school and all. He said, but to be a nurse, all you have to do is add, subtract, multiply, and divide. Can you do that? I said, oh, yeah, I can do that. He said, well, stop worrying. Who knows if you are a B nurse, a C nurse, or an A nurse? You get your license, and that's it. Your patient don't know. Just be the best nurse you can be. I said, is that all it's doing? He said, yes. And from that day forward, my whole life, my focus changed to just do my best.
Yes,
And,
instead of somebody else's best.
right. And he brought my mom in because she wanted to be a doctor, but she ended up being an educator. And he told her, he said, you're putting too much pressure on her to be an A student. She said, I don't tell her to be an A student. And I just looked at her like, yes, you do say that.
And they would have to know your mama they would have to know your mother to to know her attitude about it.
Right.
Very proper, and go like, no, I would not. I do not. So,
So,
but you were saying something about so it's a good thing you didn't know me when you were
yeah.
going through that, because I learned very early how much fun it was saying bad words. My my sister and brother, when we first heard bad words, we thought,
Uh-huh.
wow, they
Ooh.
have some secrets of bad words. So when my mother and father would leave the house, we would all
Mhm.
jump up and down on the bed and say every bad word we could. So I didn't have any digestive problems. So
Well, after that, I was able to go to the restroom. I wouldn't sweat so much. My palms weren't clammy, because I had a new focus that all I had to do was do my best. Whether it
yeah,
was a C or A or B, I couldn't do no D's or F's, but just do my level best. And
Yeah.
yeah.
so my focus changed,
Mm.
and it made me have a really a new lease on life. But um, during this pandemic, you said, well, what's causing me to be so anxious? When I was talking to a person the other day, I say, fear. Oh, I ain't scared of nothing. I say, yeah, you scared of something. You, even if it's the unknown, fear of the unknown can cause anxiety, loss
Mhm.
of the job, any uncertainties can
Mhm.
cause anxiety. You know, social isolation. A lot of us say, child, I could live all by myself. I don't need nobody for nothing. I don't know. Yes, you do. You know that song, No Man is an Island, no
Right.
man stands alone.
Right.
Each
Yeah.
man's heart is all to me. Each man's dream is my own. You need somebody, you know. And then I think about the elderly that are in these homes and nobody is visiting them. And I think about me, if I don't get a phone call from my daughter or my grandsons, I'd be wondering what's wrong. What's wrong with everybody? They ain't even calling me. But when they all get here, I'll be ready for them to go.
Go, go.
After a while, but you need somebody. Then this has shown us this social isolation and stuff. Because when we get out, we want to mix and mingle and all, and people still not wearing their mask.
Mm-mm.
Your president still not wearing his mask, and he done infected all them people in his cabinet. But like we talked last time, we just do what we need to do to protect ourselves and the immediate others and our family. But we still not practicing the proper social distancing, hand washing, face masking, and stuff that we should do. We still not, and that's why our numbers are going up. We're getting relaxed, and
Mhm.
that's our major problem.
One of
Loss
one
of
of the things that you just said, you were talking, you were getting, you going that direction, and you changed, was that it has something to do with the expectations when you were talking about fear
yes,
and what you believe about yourself and what you believe about the world and everything what you have in your head. And
mm-hmm,
until we begin to value
mm-hmm,
ourselves, then
mm-hmm,
we then have a whole different way of seeing everything. In other words, it's truly not as important. I think,
mm-hmm,
or if we have mystical thinking, like it's not going to happen to me,
mm,
because I'm just gonna, I know how to deal with it, but you're actually
mm-hmm,
not practicing doing it. I think a
that's
lot
right.
of that really has a lot to do with it, particularly
Mm-hmm,
among African American men. I'm paying attention to it because I guess they feel virile and strong and whatever. And I'm seeing all these men. When I say all these men, I can drive down and I'll see 15 and 20, and they're all huddled, they're all together
yeah,
because I
mm-hmm,
understand the need to huddle and the need to
mm-hmm,
talk and fraternize and share things, but none of them have masks on. Even on yesterday, I saw
yeah,
15 people up here at this
mm,
I guess it's a outdoor, it's some kind of a bar,
oh,
and
did
they
it?
were all going to
Yeah,
this bar,
mm-hmm,
okay, and
mm,
none of them had a mask on, and they were so close on each other, laughing and
mm,
talking and spitting
yeah,
and going on. And I was
mm-hmm.
thinking, I said, you know what? Somebody up in that little huddle got some COVID.
Two or three
Let
of
me
them.
pass by real fast,
Yeah.
roll my window up.
I think there's
But
a
you know
testosterone
what?
factor in there
Yeah.
because
Say that again. Say
it's
that
a
again.
testosterone factor. Testosterone
Yes.
Yeah,
actually comes
okay.
from the top down because they're, men, they feel, it's not manly. It's, you don't want to ever admit to any kind of weakness of any kind. But,
Mhm.
it's a difference between being manly and being safe or being proactive. It's a big difference.
Hmm.
Mhm.
And being a leader.
And
That's what
being
I
a,
say. So
oh,
I need to put a sign on my car, be a leader and wear a mask.
yeah.
So
Yeah.
I have one in my back seat. People walk up to
Mhm.
it says that be the community that you want, you know, and
Mhm.
but I think be a leader and wear a mask
Yes.
Yeah.
is what needs to be a big sign that says that. That's what I say.
Send it to
Well,
your government too.
mhm.
Say that
The
again.
time
Send it to your government too.
to
Yes,
your
that's what I
government.
said. Right. I need to put that on that, set that on out there
Right.
because we model what it is to do. And I think we were talking about that. And that is why on the last meeting we had, um, we were talking about health and obesity and whatever. And I don't care how old you get and how long it is, it's always something new, something that will help you move in the
Yeah.
right direction if you listen very carefully, if you open to
Yeah.
hearing it, if you're not in a frame of denying things. And I think what we talked about today is really setting us on the right page.
Yeah.
And I think Nurse Sanders, the way you gave it was real good as to how things can affect us physically, how
Mhm.
it fits into our mind, and how we walking around with those thoughts all the time, and that we're not with ourselves. We're out trying to please somebody else, and how we're defining who we are by looking at what somebody else defines us. And so that's a
Mhm.
part of it. So yesterday we did a presentation on African American women and health, and we're supposed to continue that. But one of the things it found is that we as African Americans are evaluating ourselves every day based on what people are saying around us. And we have had very little opportunity or taken
Mhm.
very little opportunity to learn more about ourselves and actually think about every move that we make, how we would prioritize who we are. Yeah, and I
Mhm.
like the way you presented that. And Dr. Atkins, it was so good
Yeah.
But I
looking
just
at
want to
the
say this one
at,
thing, and we'll have to continue this later. What we're going to talk about next time is developing strategies to reduce these
yes,
overwhelming and anxious feelings because it can lead to abusive behavior,
yes,
suicide, suicide ideation, homicidal ideation. And so let's reduce and exacerbation of our chronic
conditions.
conditions. So
Hmm.
next time we want to develop strategies to help ourselves to decrease these anxieties and overwhelming feelings. So,
Especially as the comorbidity with mental health and chronic
mhm,
disease. And people are
yeah,
overlooking that. They're looking at them all separate.
mhm,
And
mhm,
so it's a whole lot there together, particularly the way people think about the way we think about ourselves and what Dr. Atkins mentioned around cancer,
Hmm.
yeah,
in terms of how we
yeah,
move and what we do and
mhm,
how we're eating in our bodies. And it was
that's
so good
right.
today to be able to see how it actually develops, how it gets
Mhm,
started, and what we can do. And it's so related to mental health with that and COVID
Yes.
and the behaviors around cancer. So I think next time we could follow up with that and really look at some strategies,
mhm,
interventions, and maybe get some visuals of
Yeah.
what people can do because I'm finding that people are asking, how does this look for me? What am
mhm.
I going to have to do differently? I hear the words, but I can't quite put it in my lifestyle. I can't quite get it in my head. So I
But
think that we can
what's the strategy for you may not be
be a
the same
strategy
thing
for
for
me.
me. It has to be individualized. So as we Google and research, we need to individualize our research data to
That's right.
ourselves. Hmm.
That's right.
Well, I want to give you one strategy that everybody needs to do right now, and that's turn the news off.
Yes.
You can watch TV, watch Mayberry
Mhm.
RFD, or watch A Wonderful Life, but don't turn the news off. And
Turn it off.
yeah, so until we
Yeah.
have some. That's one common factor because with the election going on, with the COVID, with all these things, it creates that anxiety and stress that we don't. That's that stuff we don't really think about it or feel it, but it's there all the time because it creates that worry and anxiety. So if we turn it, I found out that if I look at 5 minutes of news a day, people say, "How you look at 5 minutes of news?" I said, "5 minutes, I can't take it anymore. After 5 minutes, I know who died or who didn't die, or
Yeah.
what the numbers are. I'm done. I'm done for the rest of the day. I want to go ride
Yes.
my bike or stay at home." But people need the tools that we're talking about for long-term therapy, self-therapy is what I want to call it. So yes, we need to
Well,
talk about
I think I might have to get my bike out because
it. Yeah,
everybody's doing. I might have to get my bike out. I have a bike with big seat, big
yeah,
wheels. So I can stay balanced. So I'm
yeah,
gonna have to get it out and get it checked out.
yeah.
I,
Well,
w- I mm,
so,
so,
I was concerned about your walking because you were walking. You were having some challenges there when you walked through the park and
yes, I
hit the
fell in the
T-root.
park. I have to watch. I fell flat because the concrete was not even.
No.
When you walk to the sidewalk and the concrete was not even, and I found out so many people had fallen
Oh yes,
in that place. There are two places there for sure.
yes,
In the area that we walk, and so I've been trying to stretch a lot. So I've gotten back up to 2 days. And
yes,
so now I'm going to try to get back up to 3 or 4 days. Yeah, my mobility was
yes,
hampered there in my knees and everything. So I'm working on that
yes.
to do that. But the more I move, the better it's getting.
Yeah, and the
Mm,
bike riding would be good. You can ride it on the bayou where you don't have to deal with traffic, but you can really enjoy that. I think it would be good.
yes. So I'm going to go up there on Wheeler and see if I can get my bike adjusted.
Okay.
Uh-huh. Okay, I do want to thank you and see how our talk is going to mobilize me to more action. So I want to thank you so much today, Nurse Janice Sanders and Dr. Floyd Atkins. And I know that we're going to move on this in our community and with ourselves, those of you who are listening. And I want to say that um, tune in next week. Give us a call. We're having the mental health coaching program, and I want you to sign up. Please email your interest to ips.health1@gmail.com. And you can call 281-407-3190 and sign up. Just to express your interest, leave your name, your email, and phone number. I want to say this: we have a goal of helping everybody in the community. Please sign up to do this. Get your pastor to sign up, your church to sign up. And the beauty of it is we have partnered with the university that will pay $3,000 scholarship for each person, and you only have to pay the minimum fee for the taxes and the fees, which is $150. You can't beat that. And what's going to happen? Therapists think that they don't need it. What you need is to encourage somebody to do it because they will help you help other people. And persons don't think that it can help you earn money by completing this course. But the main thing is, it's going to help your community. All the people that are needing it, couples that are fighting, police officers that may not understand. In addition, we also are getting trained in cultural competence and how to handle trauma. And we will have a weekly discussion on this by having invited guests. And so I think that you just can't lose. It's a win-win. And so we look forward to hearing from you. And this is very important. So remember this: it is not the circumstances that we meet, it is the manner in which we respond that determines health, happiness, and success. So I look forward to seeing you next week, same time, same place.